Each year, hundreds of women die during pregnancy or in the year after. However, the mortality rate of Black mothers is still nearly 3 times as high as that of white mothers. Well, here to share why this is happening and how to improve maternal health in the Black community is Kristen Shealy, Deputy Director of Maternal and Child Health at DHEC. Good to have you with us.
Thank you for having me.
So that's a national statistic. Let's home in on South Carolina. Are those numbers still about the same? Any different here?
Yes, our South Carolina Maternal Mortality and Review Committee has reviewed 3 years worth of data on pregnancy-related deaths, and we do see an overall pregnancy-related mortality ratio of 32.3 deaths per 100,000 live births. And that number has decreased since 2019. And we are also seeing a widening of the disparity between Black moms and white moms. So that's highly concerning to us at South Carolina.
So you've seen a decrease but a widening disparity. Can you explain that?
Yes, the overall maternal mortality ratio, so the number of deaths that occurred during pregnancy or up to 1 year after the end of the pregnancy, has decreased from 2019 to 2020, but there are more Black moms dying than white moms during that time frame.
And why is that? Why are we seeing those numbers shift in those ways?
Well, we do a deep dive on these deaths. We look at circumstances surrounding the death. We look at the health of the mom prior to pregnancy, and we do a deep dive to see what could have happened during the pregnancy to cause this death and if the death was preventable. So we're seeing that a lot of the moms prior to getting pregnant are diagnosed with hypertension, chronic conditions such as heart disease, or are obese. And so we know that those factors negatively impact the health of the pregnancy and the delivery. And so we are seeing that a greater majority of Black moms have those negative risk factors prior to becoming pregnant. So that is concerning, and we do encourage the moms to get in to seek care prior to getting pregnant to make sure that those chronic conditions are managed properly. But then also once the mom learns that she is pregnant, to seek prenatal care as soon as possible so that those conditions can be monitored over time. The mom can be screened for other diagnoses such as mental health conditions or substance use disorder, and then proper care coordination can occur during the pregnancy so that the mom is properly cared for, and any referrals can be made to specialists and so on.
Yeah, so health and lifestyle, big impact on mothers. What about access to health care?
Access to health care is a major concern, especially in our state. We are very rural, and we've also seen a lot of the birthing centers close within the past 10 years in those rural facilities. So access to care is of concern, and we know that the moms that are residing in those rural counties are more likely to die during childbirth or afterwards, and a higher percentage of Black moms do reside in the rural counties. So access to care is an issue. Travel distance to care is an issue. So ensuring that proper access is available to all moms is of utmost importance.
Well, we've been hearing a lot from healthcare providers like MUSC and others creating more mobile units and things like that. So it sounds like there is movement on that front. How much faster do we need to move to ensure that all of these people their needs are being met?
Absolutely. That is a great thing to talk about right now, because we are really interested in getting mobile clinics and mobile vans that can be stationed in those rural counties. And then also telehealth, using telehealth when available to make sure that those moms are connected to care when they can't physically drive and access those physical buildings. So we are trying to implement strategies and initiatives that can encourage that access issue among the rural counties when there isn't a close OB in proximity to the mom or a birthing facility.
And what about early education? Because of course, when you're talking about health and lifestyle type changes, that comes with a knowledge well before ever getting pregnant. So where do we find the education? How is that getting to the people who need it?
I think that's an important thing to address. We do know that having a primary provider is very important, because with over 50% of the pregnancies not planned, it's very important that the mom be healthy prior to conception. And so educating the mom on proper diet, nutrition, managing stress, physical activities, all important. So not only in the healthcare setting, but also in the community setting. Community health workers play an important role. Trusted peers are available to provide education and ensuring that the mom is healthy prior to pregnancy, and then also during her pregnancy and after delivery. And also educating on those early warning signs, fever, headache, dizziness, swelling, and just not feeling well after the delivery is important to monitor and quickly address.
Yes,
as well.
We've just run out of time, but I know that you have a South Carolina Maternal Morbidity and Mortality Review Committee. Real quick, within just a couple seconds here, can you tell us what some resources are out there for people to find out more information?
Yes, the Maternal Mortality Review Committee does provide a lot of recommendations for the communities and also the providers. But we also have launched an educational campaign called CDC's Hear Her campaign. And so there's a website that folks can go to look at the early warning signs and to look at ways to make sure that they are taking care of themselves and linking to healthcare as soon as possible. And actually, there are tools that can help empower the mom when she does go seek the care.
Kristen Shealy, thank you so much for your time.
Thank you very much.
We're back after this.